I want to tell you about a conversation I have had with patients dozens of times across my 60 years of practice. A patient comes to me about their hair. They describe the thinning, the shedding, the places where coverage has reduced. And then, almost always, they tell me about the things they have tried. The oils, the supplements, the shampoos, the serums, a list of preparations, some expensive, some natural, some pharmaceutical, that produced either nothing or a result that faded when they stopped. And they ask me, with a careful restraint of someone who has been disappointed before, whether there is anything else worth trying. What I tell them is this: every preparation they tried may have contained effective ingredients, but ingredients are not treatments. Delivery is treatment. The question is not what compound you apply to your scalp. The question is whether that compound reaches the follicle in a concentration sufficient to act on the biological mechanism driving the loss. And most preparations applied and rinsed or applied to the surface and left, but not delivered, answer that question with silence. Today, I am going to give you a preparation that answers it differently. 3 ingredients made in less than 40 minutes, applied to the scalp and left on for 1 hour. And I am going to explain precisely what each ingredient does at the follicle level so that you understand exactly what is happening beneath the surface from the first application. My name is Dr. Shigeaki Hinohara. I have practiced medicine in Japan for more than 60 years. I am 97 years old. Today, I am going to give you this preparation, the full method and the protocol for using it. And at the very end, I will tell you the one timing error that prevents this remedy from producing results, even when everything else is done correctly. It is a specific mistake about when in the day to apply it. Most people make it automatically, without realizing it undermines the biology the preparation is trying to support. Type the number 37 in the comments right now if you are ready to give your follicles what they need. I read every comment. Let us begin. Before I give you the preparation, I need to explain what is happening in the follicle that drives hair loss. Because this preparation addresses a specific biology, and knowing the biology is what makes you consistent when the results take the weeks they take to become visible. The hair follicle is a living organ. At its base is a structure called the dermal pillar, a cluster of highly specialized cells that govern the entire hair growth cycle. The dermal pillar receives signals. It receives blood. It receives nutrients and hormones and inflammatory messages from the surrounding tissue. And based on all of these inputs, it decides whether to grow or to rest. When hair loss is occurring, the dermal pillar is typically receiving one or more of 3 unfavorable signals simultaneously. The first is insufficient blood supply. The capillaries feeding the follicle bed have become less efficient with age, with sedentary lifestyle, or with chronic scalp tension. The follicle receives less oxygen and fewer nutrients than it needs for full productive activity. Its growth phase shortens. The hair it produces becomes finer with each cycle. The second unfavorable signal is DHT. Dihydrotestosterone is a hormone derived from testosterone. It binds to receptors in the dermal pillar and initiates miniaturization. The progressive shrinking of the follicle that over successive cycles produces finer and shorter hair until the follicle produces almost nothing. This affects both men and women, and its effect accelerates after 60 as the hormonal environment shifts. The third unfavorable signal is scalp inflammation. Chronic low-level inflammation around the follicle disrupts the molecular signals that initiate the growth phase. After each resting period, the follicle has completed its resting phase and is ready to grow again, but the inflammatory environment is suppressing the precise signaling molecule that would tell it to begin. The follicle stays quiet. The growth phase never restarts. From the outside, this looks like progressive thinning. The preparation I am about to give you addresses all 3 of these simultaneously, not one at a time together. The first ingredient is whole cloves. 10 whole cloves, not ground. The reason for whole rather than ground is specific and important. When a clove is ground, the volatile oils responsible for its most powerful biological activities are immediately released into the evaporating. By the time ground cloves reach the preparation, a significant portion of the active compounds has been lost. Whole cloves, when steeped in a carrier medium, release their oils gradually and completely into that medium over time, preserving the full concentration. Cloves contain eugenol as their primary active compound. Eugenol is one of the most potent natural vasodilators available in any kitchen ingredient. When eugenol reaches the scalp skin and penetrates through to the capillary bed beneath it, signals the smooth muscle in the capillary walls to relax. The capillaries dilate. Blood flow to the follicle bed increases measurably and immediately. This addresses the first unfavorable signal directly. The follicle that has been receiving reduced blood supply now receives more. More oxygen arrives. More nutrients arrive. The dermal pillar, which was operating at diminished capacity because its delivery system was underperforming, begins to receive what it needs for full productive activity. This is why I say new growth can begin to express itself within days of the first applications. The follicles do not change overnight, but those that were in a growth phase but growing slowly or producing fine hair because of insufficient blood supply can respond to improved circulation. Within the first week, the vasodilation is immediate. The follicle response to improved nourishment follows within days, not weeks. Eugenol also has documented anti-inflammatory properties. It inhibits NF-κB, the primary molecular switch of the inflammatory response. When eugenol is present in the scalp tissue, it reduces the production of the inflammatory compounds that have been suppressing the growth phase initiation signal in resting follicles. The brake that was holding dormant follicles in the resting phase is released. Follicles that were waiting for the inflammation to subside in order to begin a new growth cycle receive for the first time in months or years an environment in which that transition is possible. Eugenol also has antifungal activity. Scalp fungal overgrowth is more common in people over 60 than is widely recognized, and it is one of the overlooked contributors to follicle inflammation. In most people, it produces no dramatic symptoms, no obvious dandruff, no visible flaking, simply a persistent low-level disruption of the follicle microenvironment. The antifungal activity of the eugenol-infused preparation addresses this silently. 3 mechanisms from 1 ingredient: vasodilation restoring blood supply, NF-κB inhibition, releasing the inflammatory brake on dormant follicles, and antifungal activity, clearing the fungal disruption that was contributing to the inflammatory state. This is why cloves are not simply a flavoring ingredient that happens to be in a hair remedy. They are one of the most precisely targeted natural interventions for follicle biology available. The second ingredient is pure aloe vera gel, 3 TBSP fresh from the plant if you have access to one, or pure commercial aloe vera gel with no added colors or fragrances. Aloe vera addresses a dimension of follicle health that cloves do not. It contains a compound called asamannan, a long-chain polysaccharide that has documented anti-inflammatory effects in skin tissue and specific activity in the follicle environment. Where eugenol reduces inflammation through the NF-κB pathway, asamannan reduces it through a complementary mechanism involving the modulation of cytokine production. The 2 anti-inflammatory pathways operate in parallel, providing more comprehensive suppression of the follicle's inflammatory A than either ingredient alone. Aloe vera also contains compounds that directly stimulate keratinocyte proliferation, the division of the skin cells that form the structure of the hair follicle itself. Research on aloe vera's effects on hair growth has identified its role in supporting the dermal pillar cell environment and in promoting the transition from the resting phase to the active growth phase at the follicle level. But aloe vera's most practically important property in this preparation is its penetration-enhancing effect. Aloe vera contains compounds, including saponins and certain polysaccharides, that temporarily increase the permeability of the skin's outer barrier. When aloe vera is present in a topical preparation, the other active compounds in that preparation penetrate more deeply than they would without it. In this remedy, the aloe vera gel that carries the clove eugenol into the scalp is not only an anti-inflammatory agent in its own right, it is actively helping the eugenol reach the depth at which the capillary bed and the follicle tissue reside. The carrier is not passive. It is contributing to the delivery. The third ingredient is castor oil, 1 teaspoon added at the end of the preparation, rather than during the infusion period. Castor oil contains ricinoleic acid at approximately 90% of its fatty acid composition. Ricinoleic acid has 2 properties relevant to this preparation. The first is its effect on prostaglandin receptors in the scalp. Prostaglandin E2 is a signaling molecule that, when active in the follicle tissue, promotes the extension of the growth phase. Ricinoleic acid activates the receptor for prostaglandin E2, providing a direct growth phase extension signal to follicles that are currently in the active growth cycle. This means the hairs that are already growing continue growing for longer before they enter the resting phase. The growth phase extends. The hair reaches a greater length before shedding. Over months, this accumulates into meaningful additional length and density. The second property of castor oil in this preparation is viscosity. Castor oil is extraordinarily thick. When it is added to the aloe vera and clove infusion, it increases the overall viscosity of the preparation. This matters for a specific practical reason. A thin, watery preparation applied to the scalp runs. It drips from the hairline before it has had time to penetrate. A viscous preparation stays where it is placed. It maintains contact with the scalp surface for the full duration of the leave-on period. The castor oil is ensuring that the eugenol and the cynin and the ricinoleic acid remain in close contact with the follicle openings for the full hour of the treatment. It is both an active ingredient and a contact time extender. Now, let me give you the complete preparation method. Place 10 whole cloves into a small bowl. Add 3 TBSP of pure aloe vera gel. Stir to combine, ensuring the cloves are fully submerged in the gel. Cover the bowl and set it aside. Allow it to rest for exactly 30 minutes, not 20, not 10. 30 minutes is the time required for the eugenol in the whole cloves to fully migrate from the clove tissue into the aloe vera gel. You will see and smell the difference. At 30 minutes, the gel will have taken on a deeper color and the aromatic eugenol oil will be clearly detectable. The warmth and freshness of the clove scent in the gel tells you the infusion is complete. After 30 minutes, use a small spoon or fork to remove all 10 cloves from the gel and discard them. The eugenol has transferred. The clove solids are no longer needed. To the infused gel, add 1 teaspoon of castor oil. Stir thoroughly until the castor oil is fully integrated into the gel. The preparation will thicken noticeably as the castor oil incorporates. This thickening is correct. It is what gives the preparation its scalp adherence quality. The preparation is ready. It can be stored in a clean sealed jar at room temperature for up to 7 days. After 7 days, the eugenol concentration in the aloe vera begins to degrade. Prepare a fresh batch at the 7-day mark. To apply, section the hair and use your fingertips to apply the preparation directly to the scalp, not the hair strands, the scalp. Work section by section until the entire scalp is covered, giving particular focus to the areas of greatest thinning. The preparation should feel cool and slightly warming simultaneously. The cool is the aloe vera. The warming is the eugenol beginning its vasodilatory activity on the capillary bed. That warming sensation is not irritation. It is blood arriving where it had been reduced. After applying across the scalp, massage using firm circular movements with the fingertips for 5 full minutes, not 30 seconds, 5 minutes. The reasons for this duration are 2. The mechanical stimulation of a sustained scalp massage independently increases blood flow through the capillary network regardless of the active compound being applied. You are adding a physical circulatory stimulus on top of the chemical vasodilation from the eugenol, and the 5 minutes of firm movement is driving the preparation deeper into the scalp through pressure differentials at the follicle opening. The compounds are reaching the dermal pillar level, not sitting at the skin surface. Leave the preparation on the scalp for 1 full hour. Set a timer. Anabi isa ki suri unkisi. This is a leave-on treatment. The contact time is the mechanism. The eugenol, a cynin, and ricinoleic acid are all acting on the follicle tissue during this hour. Remove it early and you remove the treatment. After 1 hour, wash the hair with a gentle shampoo. Sulfate-free is preferable but not required. Rinse thoroughly with cool or lukewarm water. The preparation removes easily with a standard shampoo. Use this preparation 3 times per week, 3 fixed days in the calendar. Not once when you remember, not daily, 3 times per week. Sustains the eugenol and ricinoleic acid concentration in the scalp tissue across the week, maintaining the vasodilatory and growth-promoting conditions consistently enough for the follicle to respond. I want to tell you about a patient. His name was Diaz. He came to me at 67. He had been experiencing progressive hair thinning for 9 years. He had a significant area at the crown where hair density had reduced to the point where the scalp was visible under direct lighting. He had used a commercial minoxidil product for 2 years, which had produced some effect initially before plateauing. He had stopped using it 8 months before coming to see me. When I examined his scalp, I found what I have found in many patients who present with long-standing thinning. The scalp was tight. The skin over the crown had reduced elasticity compared to the scalp at the sides and back. This tightness is a sign of chronically reduced circulation in that area. Tight scalp skin has poor capillary perfusion. The follicles beneath tight scalp are among the most severely blood-deprived in the entire scalp, and blood-deprived follicles, as I have described, produce progressively finer hair until they produce nothing. I gave Diaz this preparation 3 times per week, 5-minute massage, 1-hour leave-on, and I asked him to specifically spend additional massage time on the tight crown area during each application session. At week 2, he noticed that the crown scalp felt different after the applications, less tight, more pliable. The eugenol vasodilation was improving the blood supply and the tissue hydration of the scalp over the area. Tighter scalp, when chronically underperfused, becomes stiffer. Better perfused scalp becomes more pliable. This was the first physical sign that something was changing. At week 5, the shedding during his morning routine had reduced noticeably. The follicles in the growth phase were extending their growth phase because of the ricinoleic acid prostaglandin inactivity. Fewer hairs were reaching the end of their cycle per week. This reduced shedding is always the first visible signal before new growth appears. At week 9, he compared his photographs. At the crown, fine hairs were visible where the scalp had been visible before, not the dense terminal hair of his 40s. Fine early hairs, vellus hairs transitioning toward terminal production. Follicles that had been in the most severe dormancy because of the tightest circulation restriction were waking up in improved blood supply environment. At week 16, Diaz came to the clinic. The change at the crown was visible without comparison photographs. The area that had been visibly bare under direct light had coverage, not full coverage. The scalp that had been showing through was now obscured by new growth. His wife, who had accompanied him to the appointment, said she had noticed the change at week 12 without being told to look for it. That unsolicited observation is the one I always wait for. It is the measure of change that has become real rather than hoped for. Before I give you your action plan, I want to address two things. The first is a question I am always asked about preparations like this. Why does it need to be left on for 1 hour? Why not rinse after 20 minutes? The eugenol in the preparation reaches the capillary bed through passive diffusion across the skin layers. Passive diffusion is slow. It takes time for the concentration at the skin surface to establish a gradient steep enough to drive meaningful quantities of the compound into the dermal tissue. Research on the transdermal penetration of eugenol has shown that meaningful concentrations in the deeper dermal layers are achieved at approximately 40 to 60 minutes of contact time. At 20 minutes, the eugenol is still primarily in the outer epidermal layers. At 60 minutes, it is in the dermal tissue where the follicle and its capillary supply reside. The 1 hour is not arbitrary. It is the pharmacokinetics of eugenol transdermal delivery. The second thing I want to address is the question of whether this preparation is safe for sensitive scalps. Eugenol in undiluted form can cause skin irritation, particularly on skin with a compromised barrier. In this preparation, the eugenol is delivered in aloe vera gel at a concentration determined by the 30 and that infusion of 10 whole cloves. This is a gentle concentration. The vast majority of people with normal scalps will experience only the warming vasodilation sensation and nothing more. If you have a known sensitivity to cloves or eugenol, perform a patch test behind the ear with the prepared gel before applying to the full scalp. Leave the patch test for 20 minutes and assess. If no irritation develops, proceed with the full application. If mild warmth develops without redness or discomfort, this is the expected vasodilatory response, not irritation. Now, the timing mistake I promised. This is the error that prevents this preparation from producing results in the time frame it is capable of producing them. Most people apply scalp treatments in the morning as part of their morning routine. They apply the preparation before work, set a timer, wash it out, and go about the day. This is convenient. It is also the least effective timing for this specific preparation. Here is the reason. Hair follicles follow a circadian rhythm. The mitotic activity of the follicle matrix cells, the cell division that produces the hair shaft, peaks during the late evening and early overnight hours. This is when the follicle's own biological activity is highest. When the eugenol and rinoleic acid and asmaran are present in the follicle tissue during this window of peak mitotic activity, their effect on the growth signaling is most potent. They are acting at the moment when the follicle is most receptive. An application in the morning delivers the active compounds during the period of lowest follicle mitotic activity. The compounds are present, but the follicle is not in its peak responsive state. The same preparation applied in the evening 2 to 3 hours before sleep, so that the 1 hour contact time ends with a wash before sleep, or applied and left on overnight, delivers the compounds precisely when the follicle biology is at its most active and most responsive. Apply this preparation in the evening. Begin the application 2 hours before you intend to sleep. 1 hour of contact time. Wash out gently. Sleep. The follicles will be receiving the growth environment signals during exactly the overnight hours when they are most able to respond to them. Here are your 3 steps for this week. Step 1. Make the preparation today or this evening. 10 whole cloves in 3 TBSP of aloe vera gel. Cover and rest for 30 minutes. Remove the cloves. Add 1 TSP of castor oil. Stir. Store in a clean jar. Your first batch is ready in 35 minutes. Step 2. Choose your 3 application days this week. I suggest Monday, Wednesday, and Friday evenings, or Tuesday, Thursday, and Saturday. Write them in the calendar. Each session is 1 hour of leave-on time, plus 5 minutes of massage. Total active time per session is 6 minutes. The rest is time you can spend on other activities with the preparation working on your scalp. Step 3. Take photographs of the areas of greatest thinning today, before your first application, in direct natural light from the angle that shows the thinning most clearly. Store them with a date. Set reminders for 2 weeks, 5 weeks, and 9 weeks to retake them. At 2 weeks, the shedding will have begun to reduce. At 5 weeks, fine new growth will be appearing in the most responsive areas. At 9 weeks, the density change will be visible in the photographs in a way that will be difficult to ignore. Without the photographs, gradual change is easy to miss day by day, and you will be more likely to stop before the results are fully expressed. I want to bring you back to where we began. The patients who come to me with a list of things they have tried, the careful restraint of someone who has been disappointed before. What I tell them is that their disappointment is not evidence that their follicles cannot respond. It is evidence that what they tried did not deliver the active compounds to the follicle at a concentration sufficient to act on the biology. The preparation I have given you today does. The eugenol reaches the capillary bed at 60 minutes of contact time. The examinin reduces the inflammatory barrier that was holding dormant follicles in the resting phase. The rinoleic acid extends the growth phase of the follicles that are currently producing, and the 5-minute massage at the beginning adds mechanical circulation stimulation on top of all three. Daisy's wife noticed at week 12 without being told to look. That is the standard. Not the photograph, not the brush test, not counting hairs in the shower, the unsolicited observation of someone who simply sees you. Make the preparation tonight, apply it this evening, massage for 5 minutes, leave it for 1 hour. If you typed 37 in the comments at the beginning of this video, that commitment matters. Begin tonight. Please subscribe if today was useful to you. Leave a comment telling me which area of your scalp is of greatest concern and how long the thinning has been present. I read everyone.